So, good morning. I'm Adam Brenner. I'm the Vice Chair for Education for the Department of Psychiatry here, and one of the directors of continuing medical education here, along with Laura Howe Martin, who's in the front row. This is part of our new this year's psychiatry update series, where we're trying to offer a kind of a quarterly series of weekend events that will really span a wide range of issues in psychiatry. I'm, of course, especially happy that we have one focused so squarely on issues of psychotherapy. We could not have done this event today without the following groups becoming sponsors and exhibitors, and you saw their tables out front, but I can't express my thanks enough. The Dallas Psychological Association, the Dallas Psychoanalytic Center, the Dallas Society for Psychoanalytic Psychology, and the Group Analytic Practice of Dallas, and do I have this name right? Therapy Dallas? So please stop off and visit with the exhibitors at the tables during breaks, and we are very, very appreciative. I think it's a wonderful thing that we can bring together this many different kinds of organizations to put this on together. A very important thank you to Dr. Dale Godbee. So this event was Dr. Godbee's idea. It was his brainchild, and he has provided the leadership in conceptualizing this for us, in leading our group in designing the structure of the event, in recruiting our presenters, our exhibitors. We absolutely wouldn't be doing any of this without Dr. Godbee. We want to thank Dr. Malcolm Bonheim and Dr. Kristen Ohlenforst for being crucial in doing kind of mock therapy interviews to help prepare our simulated patient this morning. I want to thank Dr. John Sadler, who, due to a conflict, wasn't able to be here today, but was really critical in helping us plan this. A thank you to David Bullock and Kevin Mitchell from UT Southwestern's MedTV for helping us be able to create a real record, a video record of this event. And my biggest thank you to Janice Robinson, and round of applause, please. So Janice is our administrator for our CME events, and really it goes so above and beyond what duties would require in making these events happen, shepherding us all along and attending to everyone's needs, and thank you. So now I'm going to turn this over to Dr. Godbee, who is going to speak from his role as our virtual clinic director. Is that what you say? Dr. Godbee.
Well, thanks, Adam. The truth is this event evolved out of a Grand Rounds Committee, and I think without Dr. Brenner's support, we wouldn't be here today. So it takes a lot of workers together to make this happen. We've created a fiction for you today, and we're hoping that it's really the best way to tell the truth about the two types of psychotherapy that we'll be observing. I'm thinking that in some ways I would like to propose to the audience a fiction within a fiction. And I would like to say to you that imagine that the interviewers are unable to make it. And for this program to go forward today, I'm going to have to ask the audience for volunteers in order to do the interview with our patient. And I'm wondering how many of you would raise your hand and volunteer, or maybe charge the stage with the opportunity to become a star. Would any of you be willing to do these interviews today? You would have just as much preparation as our interviewers. So do I see any hands? I'm not seeing any hands. I know a lot of you out there today. Don't make me start calling names, okay? So nobody's volunteering. Even if I was to sweeten the deal a little bit and say, we've got a hair and makeup guy here, he could look really good under the lights, and we'll give you a free DVD. How about that? Got any hands in the air yet? I was afraid of that, you know. I'm thinking that we should keep this in mind as we're watching our interviewers, okay? I think it will help us understand the pressure really that goes into doing this kind of thing. I'd like to say just a few words of introduction about how I see the essential tension between these two types of psychotherapy. To put it simply, we might ask, how can we make use of science without it foreclosing too much of what is important about psychotherapy? And on the other hand, can we find a way to make use of the emergent and improvisational qualities of psychoanalytic psychotherapy without forsaking the gains of science? So keep that in mind as we're watching these interviews. What we value impacts how we listen. Values motivate and prompt how we listen and how we intervene with patients. Shakespeare's a good prompter when he says, "When our naked frailties are hid that suffer in exposure, let us meet and question this most bloody piece of work." When our naked frailties are hid that suffer in exposure. Now, if we're prompted by a line like that, we're going to want to monitor the patient's shame as we hope to unfold, illuminate, and transform their subjective experience. This kind of listening is interested in psychotherapy as an emergent process. It's interested in courting surprise, and it's interested in the kind of emotional truth that lies behind the pain that brings many people to therapy. Another form of prompting might be for us to listen to and pay attention to multi-site randomized clinical trials. In this case, we might be paying attention to protocols that were specifically designed to help the problem that's being presented. You know, and in this case, we might make use of a manual. Hopefully, we'd make creative use of the manual. And, you know, at this point, it becomes somewhat easy to start to stereotype CBT and think about manual-driven technicians. But, you know, I think that's an unfair characterization, because we can think about a manual as a recipe. And, you know, we could give, every great chef likes a good recipe. And we could give Thomas Keller's favorite recipe to a couple of great chefs, let's say Eric Repair or Patrick O'Connell, and they would come up with a dish. We would recognize the dish, but it would have a particular creative twist that I think Keller would enjoy himself. I think the same could be said about a piece of music. We could take a score of a Mozart sonata and give it to Glenn Gould or Vladimir Horowitz, and they would give us a piece that was recognizably Mozart, but would affect us each in a very unique sort of way. So, you know, when you use a manual, I think you pay attention to the therapeutic alliance, and you pay attention also to other factors that have been shown to be effective in successful psychotherapy. So my role primarily, as Dr. Brenner was saying, is to sort of play the fiction of being a clinic director. And I'm fortunate today to have two outstanding therapists, in Dr. Robin Jarrett and Dr. Jerry Melchiotti, on my staff. The dilemma I'm faced with is that I've seen a patient for the first time. I've given her some psychological tests. She's a 25-year-old. Sherry Wickman is her name. And I'm trying to decide what would be the best form of treatment, CBT or psychodynamic. And I can't decide. So I've decided to have each of them do an interview. This will be the first time that they've seen this patient. All they have is the information that you guys have. And I'm going to ask them to have a conversation with us and help us to decide how we should proceed. You have in your packet sort of just a brief outline of the information that I gathered. I would say briefly about the patient that she's anxious and depressed in a mild sort of way. I don't think we would make any major diagnosis from DSM. If we had to diagnose her, we would probably say that she was adjustment reaction with mixed emotional features. So we're asking you, as you observe the therapist today working, try to put yourself in their shoes. Try to think about how you would like to proceed and what you'd like to know. We already know that none of you would like to be up here in front of this audience doing these interviews. But we want you to, think about what sort of values, what sort of ethics would inform your decision-making about what type of treatment you would recommend. Too often we reside in our own psychotherapeutic enclaves and rarely getting beyond our stereotypes of one another. So we're hoping to get beyond that today. So let's get underway and meet Sherry Wickman.